Today we're going to do Calcarea carbonica, or also known as Calcarea ostiarum. This is a remedy which is derived from the oyster. Sepia, as you know, is the ink of the cuttlefish, and Calcarea carbonica, our remedy, is made from the middle layer of the oyster. This is what the oyster secretes in making its shell, and it is actually pure crystalline calcium carbonate. And Hahnemann used this to make the remedy. He triturated it. It's one of the first remedies he actually triturated. If you might remember how remedies are made, trituration is the process of grinding the substance with milk sugar to a C3, and from there you start to succuss it in liquid. So looking at the oyster, what sort of thoughts or images come up for you? Yes, it shuts very tightly, right? It's hard. Yep. So the shell is very hard, very good. We'll collect some of these things already. So it shuts tightly. Let's see if this works. It's hard. But where is it hard? On the outside. So the oyster is hard on the outside. Yes, and soft on the inside. So you've got the essence of the remedy already. What else is it like on the inside? It's soft and slimy. Yeah. Salty? Yeah. In this wonderful picture here. Yep. It's clammy and cold, right? It doesn't move, right? So the oyster just sits there at the bottom of the sea quite happily. So it's inert. The only movement it actually makes it shuts itself tightly. So you can imagine this oyster producing this shell and sitting there and just sitting on the bottom of the sea and doing nothing apart from sitting there, opening and closing its shell. And it closes it as soon as the slightest movement of water passes, very, very tightly. It literally clams up and stays closed. And looking at that, you already have the essence of the remedy, Calcarea carbonica. They'll be hard on the outside, protecting a very soft, vulnerable inside. The remedy has this image of inertia, just like the oyster. It's a remedy or a picture that doesn't have much movement. Not like your Lacazis will go out there, or your Nux Vomica's are out there. The Calcarb will just quietly sit there. And you'll see that running through when we do the children and the adults. Looking at it from a chemical point of view, do you still remember your periodic chart of elements? Long, long ago. Natrum belongs in the first group, but they're very closely related. So you've got group 1, in which we've got natrum, potassium. Natrum is in the 3rd period, potassium in the 4th, and then you have your group 2, in which we've got calcium, that's right, in the 4th period, and magnesium. These 4 remedies together, as you learn about the kali salts and later about magnesium, are very closely linked. Fluoride would be in chlor. Chlor is in group 7A of the periodic charts of elements, so it doesn't belong here. But these that you already mentioned are very interesting to look at together if we look at the chemistry. And we're going to focus on calcium now. But if you might remember, as you go down through the periods, that the number of orbits increase. So in the 4th period, we will have 4 orbits of the atom. And you might remember that the outer orbit always likes to have 8 electrons to be stable. And if it has more or less, if it has quite a lot, it looks to attract another electron to be complete. Or if it only has a few in its outer shell, like potassium and sodium, it will want to give it away. And calcium, being in the second group, has got 2 electrons in its inner orbit, 8, 8, and 2. So it will need 6 to become complete and to have a harmony. So what it will tend to do, it will want to give 2 away. And then go into connections like with the sulfates, where you can have calcarea sulfurica, which we'll talk about it later, or calcarea phosphorica, because these elements at the other end of the periodic chart want to attract. Phosphorus goes out to attract people. Calcarea likes to have people around, but it'll sit there and have people come to them. So there you can see, by just looking at the element itself, you can get an idea of how the remedy will react. Similar to magnesium, which has got 3 orbits, so it's got 2, 8, and 2. Magnesium is much more reactive than calcium, because you can see it only has 3 orbits, so these 2 electrons are closer to the actual nucleus. It'll be a bit more difficult giving them away, whereas calcarea, with it being further away, there's a lot less action, electronic action pulling these 2, so it quite easily gives these 2 electrons away and seeks to form a harmony with other people or with other elements. These 4 are also interesting, because if you might remember your, I don't know if you call it ringer solution in Britain as well. Did you used to call that as well? We used to call that in Germany. In your ringer solution, you have, these are the 4 main elements or minerals that you have got in your ringer solution as well. So these are quite essential for the human body. And calcium is actually the element, the anorganic element, which is highest, has the highest concentration in the human body, followed by phosphorus. Whereabouts in the human body does calcium play a role? Bones, foremost. Teeth, right? The heart. The heart, yeah. So it also deals with tissue irritability. Like your potassium and your sodium will increase tissue irritability. Magnesium and calcium will bring it down. As you might know, people who suffer from cramps probably treat them with magnesium. I don't know how popular it was in Britain, but Germany, it was quite in vogue for a while when people hyperventilated, not only to give them the plastic bag to pull over their head, but also to inject calcium to get them out of the tetanus, the typical tetanus that you would produce in hyperventilation because of the alkalinization of the blood and more calcium ions being bound to the proteins and being less available to keep up membrane stability. As you already know from the heart, it has an effect there on the heart muscles, reducing the heart rate, and also on the blood pressure. That we used calcium antagonists to change the calcium and natrium pump to influence the blood pressure. So calcium is functionally connected with solidification, a formation, so it brings a certain solidity into the system. If we look at it in the body, we mentioned the bones. The bones bring the structure. They give us the possibility to walk upright, and they're also protective. The skull protecting the soft and vulnerable brain, the spinal cord protecting the vulnerable, the vertebrae protecting the vulnerable spinal cord. So you have a bit of the picture there from the oyster, outside hard, protecting the soft inside, and calcium in the body having a similar function. Okay, so we mentioned its affinities that it has in the system, which is to the heart, skeletal muscle, where it also influences the membrane potential, bones and lymphatic tissues. Not only does the oyster, is it inert, but it also produces something quite beautiful, which is a pearl. But to forget that. So it has this aspect about it as well. It can create something very beautiful. They might be inert and immobile, but it also has the potential to produce something under a lot of effort, because, as you know, the oyster is irritated by a grain of sand around which it then secretes substances to form a beautiful pearl. If we look at the typology, yesterday I mentioned the peanuts. Just pause here. We've got our picture of Charlie Brown being the calc carb. So if you look at the images, if you look at a calc carb person, you'll often recognize them. They'll have a slightly roundish head, and their hands will be quite square. They'll have short, stubby fingers, and if we all look at our hands, like, you can tell that somewhere underneath I've got a lot of calc carb, and if you all look at yourselves, you can probably see what type of basic constitution you have, because we all are very basic constitution when we once start off, either phosphoric nature, a calc nature, or a sulfuric nature. And then as life goes by, we become more and more complex and complicated. And we can all see just by looking at ourselves and our shapes where we have a basic affinity to this. So if you look at a person or children coming in, you can often get an idea, aha, this is probably an issue for them, that they might belong to that type of remedy group. They have a phosphoric taint, a calc taint, and then look at related remedies that might fit into that family to give you an aid to look for their basic constitutional remedy. And Charlie Brown's the born loser as well. As you know, Charlie Brown's team never wins a baseball game, and he never sees the great pumpkin, and he also never gets to the little girl with the red hair. And a bit like that, the calc carb personality can be a bit of a loser. They try, but they only try to a certain point, because they get terribly exerted out of proportion for what they actually physically or mentally do if they need the remedy. So just walking up a flight of stairs, they'll totally be pooped out. Or doing a bit of mental work, it will really drain them. On the other hand, once they get stuck into something, they can be quite hard-working and reliable, but they're never going to be your sparkling personalities. They'll be the people who, you sit them at their job, they'll do it. They might even stay in their jobs for 20 or 30 years without a promotion, but they're content. They're not unhappy about this. You have your person sitting behind the same counter in the bank for all these years, doing his or her job to a very high standard and great satisfaction, and they're very, very content at not moving about at all. If you put pressure on them, though, they can perform. And that's where we have the pearl coming out. And Catherine Coulter has a wonderful book about the psychological types in homeopathy. And she describes both Mozart and Helen Keller as being calcarea carbonicas that produce a pearl. And if some of you have seen pictures of Mozart when he was a young lad with this big forehead, the rather roundish face, and this rather flabby, inert being on these paintings or photographs, and Leopold putting the pressure on young Wolfgang Amadeus, and he then becomes this absolutely amazing composer, but always has this thing about him which is also typical for calc carb, a slight immaturity. Those of you who might have seen the film Amadeus, there's always a bit of a childlikeness. He can't deal with the real matters of life. Financially, he's always in the pits. He never quite makes it, always on the verge of not having enough money, and quite an infantileness about him, which you will also find in the carbonic elements, that they have a bit of a childishness which they preserve. Helen Keller as well, who lost her sight and hearing, I think was it through measles, the age of 18 months, who totally collapsed within herself until she met Annie Sullivan, and Annie Sullivan looked after her, put a lot of pressure on her again, and within years, I mean, she learned tremendous things and went out to to be a speaker as a blind and deaf person and perform marvelous things, again, under the constant pressure of someone who made her then into what she later was. And you'll find that with the calc personality in general, if they have that tiny bit of pressure on them, they can go out and perform great things. So if you look at the children that you'll often recognize a calc carb baby immediately. They'll be your fleshy and flabby babies who've got lots of rings of fat around them, the nice round heads, often looking a bit more pale. They won't have the same rosy cheeks that you can find in a sulfur baby, because have you done sulfur as a remedy? No. Sulfur is another one of the big polycrests, and sulfur can be quite big as well, but they'll often have a full-bloodedness about them. They'll often have more of a color, whereas your calc will be slightly more pasty. They'll have very large heads and often a rather big abdomen as well. And if you see them at a young stage, they can have quite large fontanelles, or their fontanelles will be late to close. There you can see the calcium coming in with the bone structure and the ossification. They can also have, as children, lots of spinal disorders. You'll find scoliosis or spina bifida amongst calc children. As you mentioned, the teeth, often there'll be a remedy for late dentition. That will be delayed, or slightly delayed development, but more in the calc carb, not due to an intellectual impairment, but due to the physical impairment, that their bone structure isn't quite up to scratch. That is a differentiation to a remedy you learn later, which is Baryta carbonica, another carbonic remedy, which is slow because of an intellectual difficulty. They're slow to grasp, slow to learn to walk, because they can't grasp this on a mental level. Calcarea can't function on the physical level. They sweat, even though they're chilly. It's a chilly remedy, but they can sweat quite easily. And often, if you ask the mother or the father, they will sweat on the scalp and at the nape of the neck, or the head will be quite sweaty. And it'll often be a cold sweat. There's also the difficulty with the temperature regulation. Your calc carb is chilly, but they can often overheat in bed at night. So you ask the person if they'd wear socks to bed at night, or a hot water bottle, and then in the night they'll take off their socks and often stick their feet out of the covers. So they'll go very wrapped up into bed, and at night they'll overheat. And one thing they also easily suffer from is upper respiratory tract infections, that they're very prone to catch colds. And then we have the connection to the lymphatic system, that they'll get a lot of swollen glands, and quite large swollen glands. The adult calc carb will more often be of a short and stocky build. As I mentioned, they'll have the stubby fingers. There is a tendency to put on weight because of the slowed down metabolism that the calcium person will have. It's often worth asking at what stage the young people started their puberty, because they will often, the women will have a delayed menarche, and the men will then develop delayed sexual development as well. So it's always important to ask, to try to get the picture when a person went into puberty and how long it actually took them to fully develop. And general is there's a slowness about them that I mentioned. There are certain clinical indications for calcarea carbonica, but you don't have it as much as a pathological remedy as you might have others. Calcarea carbonica you will find you will use most on a constitutional level, when you find certain pathologies that tie in with a calc appearance and calc behavior. So I can't think at the top of my head where I've used calcarea as the so-called acute remedy, unless it might have been a calc constitution. Whereas other remedies like nux vomica, you might just give for ulcer pains, or lachesis you could just give for trauma phlebitis. The calc, you'll most often encounter it as a constitutional picture and prescribe it in that way. And if you can imagine this inert, very vulnerable oyster sitting there, apart from clamming to defend itself, it hasn't got much more to do. Calcarea has got a lot of fears as well. It's one of the most fearful remedies in the materia medica. Lots of anxieties about their health. They have fear of serious illnesses, fear of cancer. Children are very fearful of ghosts. They have nightmares. They're very fearful of spiders and insects. And one big thing is fear of going mad. They have a great fear of insanity. And that also comes out of the fear of being observed, because they always feel they're not quite good enough. So they feel that people are always watching them. And you can ask people how self-conscious they are, and some people actually present that to you, that they always think people are looking at them and watching them. And this comes out of this deep insecurity that they're not quite good enough, that people will pick up, that they're just not that confident, and someone will see straight through them and see their vulnerabilities. As I said earlier, they're very hard and steady workers when they're in a healthy state, and very responsible and complacent. Calc carbs like their family and are quite happy at leading what many people would consider a boring life. Happiness for a calc carb is sitting at home with their family, watching the telly and having a takeaway. And sometimes you get like whole calc carb families, like a holiday for them wouldn't really excite them. You know, happiness and contentment is when they're all nice and harmonious, sitting there having rather plain foods. They won't go for your Indian curry. They like nice, plain, stodgy foods. Children desire carbohydrates, bread, pasta, eggs, and that is bliss for a Calcarea carbonica. If you ask people, one of my patients says, well, oh no, not holidays. I'm happy when my children are all at home and we just sit there and have a nice weekend together. It just gives you the picture there. They're also very sensitive to cruelty. They can't stand to hear bad news. And if you ask the calc carb, they'll often turn the radio off. Well, they won't listen to Radio 4 because there's just too much horror stories. Radio 3 is fine. The news there are not that often, and I can cope with hearing that. But Radio 4, they won't listen to that. And they'll even sometimes turn the television off because they just can't bear to see the cruelty in this world. It's just too much for them. And we have the other side as well with their stubbornness. And they can be very stubborn and obstinate and wall themselves off, close themselves within their shell, and have a tendency to go alone and lose the social contact when they're out of balance, even though they like to have people around them. When they are out of balance, they will go off and be alone, and they can be loners in a way as well. Those can be your children who have their toys and can sit quite happily and undisturbed and concentrate on playing just with one toy. So this just gives you a bit of the essence of this remedy. Talked about the mensals. From the general point of view, what you'd be looking for in a calc carb is that they tend to have right-sided symptoms. As I said earlier, they'll be very chilly, very sensitive to damp. Their sweat will often have a sourness, and if you can see there that chemically calcium is an alkalizing buffer. So if this is out of balance, you'll have a certain acidity. So the sweat and the discharges can often be sour. And if you smell the children, they might smell a bit like yogurt or have a slightly sour smell to them. Interesting enough, you don't find many of these things anymore, I think because people tend to wash themselves much more nowadays. Like, I've never encountered anyone, if you read the Materia Medica, like your silica with the corrosive foot sweat that goes through socks. I think people maybe change their socks more often. You never get to those stages. But you can sometimes still find, if you ask parents or also partners of people, that they can sort of like pick up that there is a certain odor to their bodily discharges. They like to eat quite indigestible things. You'll have children eating sand in handfuls, not just because they want to try it, as kids put it in their mouth. They really literally like to eat dirt or eat charcoal or pencils. They have an issue about eggs, a bit like your natrum has an issue about salt. So either they'll really crave eggs, or you can have the opposite again, which is rarer but also possible, that they have an aversion to eggs. Then there's the issue with the calcium metabolism, that they have an aversion to milk, and sometimes even an aggravation to milk, that some children can't even tolerate mother's milk. And they don't like slimy foods. There's also a problem about fat, that they don't like very fatty foods either. Just looking through the systems where you would see an action of calcarea, in the ENT focus, you'll often find otitis, in particular with children, otitis with the purulent discharge, more right-sided than left-sided. Or the tonsils, tonsillitis with the enlarged glands, the gland enlargement going again through through all the calc salts that you'll hear later, and also baryta carbonica. Baryta carbonica, in differentiation to the calc, will have very hard and indurated glands, where the calc glands will be a bit softer. On the cardiovascular side, they'll often have palpitations and a tendency to arteriosclerosis. There you have the calcifying component of calcarea. In the respiratory tract, they'll have a very tickly cough, persistent, and very prone to recurrent infections. They can easily get breathless and worn out, walking in particular against the wind. Looking at the alimentary tract, there's a lot of sourness there. You can have the sourness with diarrhea, sour eructations. They often have quite a distended abdomen. And strangely enough, calc is one of the 4 remedies with serinum, I think carbo-veg, and mercury. That's better for constipation. So they're not troubled when they're bunged up. Most people will come to you and be grateful if you can help them shift their bowels. In particular, calc children are quite happy and content, hanging on to their stools, and are not very troubled by being constipated. With the laxness of the tissues, you'll often find an anal prolapse in the calc picture, and their stools can often be of a pale color like clay. Looking in the genital sphere, the discharges that a calc will have will often be quite thick, white discharges when you think of thrush. Another remedy that's very... Have you done pulsatilla? Yes, pulsatilla having the white, thick discharges as well. A very different general picture to calc. And often the breasts will be quite nodular in a woman, because there again you have the tendency to induration that you will find with other glands as well. Calc you'll find is a very useful remedy for skin conditions. Often children will have had a cradle cap. There's a lot of eczema there, eczema with a tendency to be infected because the skin takes quite long to heal. You have the slowness in the remedy there. Very easily cracked and chapped skin. Or in children, often also the impetigo. So if there's one thing that you should remember about calc, to zoom in and see this, is the slowness and the delayed development that will go throughout their lives. You'll ask them at college or at university. They'll make it, and they'll often be quite good, but they will have to have worked hard. They're not your people who just walk in and out and will perform wonderfully. They'll perform, but they will have worked for it, the calc people. They'll have lots of fears and anxieties about their family, about their mental well-being, often quite frightening nightmares. They'll often be timid people with little confidence, the strong desire for security, where the picture of the family again comes in, the family unit providing the security. The chilly, they don't like the cold and the damp. They're worse for exertion, and they often get colds. And if you remember these few points, you will often immediately be able to spot your calcarea personality. Have you come across Jan Scholten's book, Homeopathy and Minerals? I think it's very useful. In particular, you'll find it useful in advanced stages, because what Jan is a Dutch homeopathic doctor who's looked at the minerals and has formed certain themes for each of the minerals themselves, and then in combination he's done all the calcium salts, the natrium salts, the potassium salts, and there are some that we'll speak about later that are not very well known and proven, that are so-called small remedies, but with the themes that Jan has made to these remedies, you can find them a lot easier. So, you know, for reading in the future, I'd really recommend getting his book. I mean, I learned a lot through looking at that, and it's very, very valuable in getting an idea of the components. Like what we have here is calcium carbonate. So we have two components here, the carbon element and the calc element. And if we look at the carbon element, carbon belongs in group 4 in the periodic chart, so it'll have 4 electrons in its outer shell, so it can either give or take. So there's a bit more of a stability there. And the carbonic element in all of the combination is the element that sort of like gives a meaning, and there's a sense of self-worth, and that is often the worker aspect. So if you look at such things as natrium carbonicum or kali carbonicum, you will see this carbonic element coming through in all these remedies within the special aspect of the cations there as well. So it's really nice and recommended reading for you. I've also got a calc carb case. This is a 45-year-old woman that came to see me with recurrent bronchitis that she'd been having over the past years. The last episode she had was about 3 months before she came to see me, and it had never fully cleared, even though she had several courses of antibiotics, and she was left with quite a persistent tickly cough and some catarrh. She's quite a tall woman, of a sturdy build, but not tremendously overweight, but a bit thicker around the middle, blonde-haired, blue-eyed. And she had something slightly tense and nervous about her. In the past history, she'd had a lot of bronchitis as a child and teenager. She has multiple allergies and is prone to constipation. At the age of 4, she had typhoid. Her periods were regular, and she had 2 normal pregnancies and births. In the family history, there was cancer on the maternal side with the grandmother, and diabetes with a paternal grandfather. She herself hated the cold and liked the warmth. She liked salad and cheese and didn't like fatty foods, milk or crab. And she described herself as being a very nervous person, worrying a lot, in particular about the children and the husband. She herself is a wind player. And again, yesterday, like the Lacazes case, you don't often get this, but she described herself as being jelly underneath and tough on the top. So there you had it again. It's not that I don't get many patients who say this, so unfortunately that would make life so easy if everyone would come like that. But she said this several times when I asked her what she was like. She had a lot of stage fright when she was performing. She doesn't perform as much now with the children, but she used to work full-time before they had the family. She doesn't like confrontation. She loves things to be very harmonious, and she'll go out of her way to make things harmonious. I now got to know the husband as well, because she sent him along for treatment, and he's the complete opposite. He's just all over the place, Mr. Fix-It, running around, dashing throughout the country, managing an orchestra. And she seems to be the one in the family who gives the stability, whereas he's the energetic one who rushes about. On a physical level, she had a productive cough with green phlegm that was at times also colorless. She was better if she had warm drinks. Her bowels tended to be very dry and irregular. So I gave her calc carb 200. And prior to her coming back, they had a tragic accident in the family, and one of the family members, not in her immediate family, but the close family, was killed. And she couldn't make it to the follow-up appointment. So for the bereavement, I sent her Ignatia, with which she coped very well going through this very traumatic phase. Have you done Ignatia as a remedy? Some of you know it. Ignatia is the Ignatz bean, and it is a remedy that is very, very useful for acute trauma and grief. It's known to be the acute of Natrum muriaticum. So often if people would get their Ignatia in the state of the acute grief, they won't go into your Natrum state. You will often prevent them from going into that, into withdrawing. And that helped her get through this, so we had to postpone the actual follow-up. And when I did see her then, she said after the remedy, her cough had cleared completely, her bowels had become regular, and she felt much more energetic and a lot better in herself. But 3 weeks after that, her constipation returned. But apart from that, she was fine. So I asked myself, why did the constipation return? And interestingly enough, she started drinking coffee 3 weeks later. So you don't often have this, but it's always worth looking for an antidote. And I'm not saying that coffee antidotes every remedy, because I have a great fondness for coffee and can understand if I tell people not to drink it, at least until I see them once. I like to see them once for the follow-up, that they try to stay off it. I mean, if you have someone who's addicted to coffee and has about 6 cups a day, you won't immediately take them off it because they can have severe withdrawal symptoms. I don't know if any of you are passionate coffee drinkers. So in her case, she was sensitive to the coffee. And I asked her to please stay off it until we spoken again and repeated the remedy. And actually the constipation cleared. And now many months later, she is still doing fine and is still staying off the coffee. So she hasn't made another appointment, so I just will hear and stay in touch from her because she sent her husband and nephew along now for treatment. So in that way I'll still have contact with the family. So that's quite an interesting case there.
Ask someone to stop the coffee for?
Wow.
3 days. I mean, how long
It's very, if people are sensitive, I'd ask them to stay off it for as long as they can bear staying off it. I mean, you can't tell people what to do with for the rest of their lives. If you ask someone like Jonathan Shore, he asks his patient to stay off coffee for 3 years. 3 years, because he feels after 3 years the remedy has manifested itself to that stage that it can't be antidoted anymore. If you talk to someone like Massimo Mangiavori, an Italian homeopath, he says, I never tell my patients to stay off coffee, because probably he himself loves his coffee as much. And I think Vitulkas, similarly, Vitulkas will never answer any questions regarding coffee. And Massimo says, I've never had it interfere. But I know for myself that when I took certain remedies and I had my coffee, I know I stopped the remedy action, and with other remedies I didn't. So it's often finding out what people's sensitivities are and to which remedies they don't, they can antidote and which they don't. And the other thing, obviously, is there's the other argument in homeopathy. If you actually hit the simillimum and you get the simillimum right, nothing can antidote the simillimum. But what we mainly do in most cases is we get the partial simillimum. We never find it to 100%. So that's one argument where homeopaths say, all right, if you get it 100% right, you don't have to worry about anything. But I also see that there are people who just have more of a sensitivity than others. That's been my experience.
So a week, 2 weeks, just,
No, I usually say if people only drink small amounts of coffee and they can manage to stay off it until I see them for the first follow-up, which would be about a month. And those people who are real coffeeholics, I just at least ask them to cut it down and see what happens then. No. No. Because it's not the caffeine that antidotes the remedy, funnily enough. It's something in the coffee itself. And it's not for every remedy either. So it isn't the caffeine.
I do find it has quite a dramatic antidotus effect quite often.
Right.
It's so difficult trying to piecemeal together a remedy that to have something like coffee sitting there interfering just makes it so much more difficult.
Did you have something to do with it? I mean, does I say, oh, just one coffee a day? Would it be okay if someone makes it?
Not necessarily. If they're sensitive, like this woman here didn't have a lot. She just went and had a couple of cups at the weekend, and after that her constipation returned, and it was quite marked, because I tried to figure out why it was then, and then she remembered what she did, and after which it returned. So we thought that that must be the case, and now that she hasn't been taking the coffee, it's been months since then, she's fine, and she's very regular, and her symptoms have cleared entirely. So we deducted that must have been the case, because it was before the bereavement as well. The other thing that you could have thought of, sometimes emotional shocks can antidote a remedy, like this bereavement and this terrible shock that she had of the family member being killed, can sometimes antidote a remedy as well, and you would then repeat it. I've seen remedies being antidoted by emotional trauma.
The problem with coffee, though, seems also to be that it's not like it antidotes it, and then after the coffee wears off, the remedy works again. It seems to just stop it in
Yes.
its tracks, and you have to give it again.
Yes, it sometimes can. And sometimes you can lose a case as well. Sometimes you'll have to go for quite a run and zigzagging to try to get it back on course again. In her case, it was easy, thank goodness. Are there any other questions you have regarding calc carb? Russell's got a video, but I don't know if it's in here. I'll wait for him to do, because he'll know more a bit about the case so that you can see that. Maybe what we can do is start with the calcium salts. And there start with calc fluor. If we look at the components again, we've got fluorine, which is an halogen, which belongs in the same group as chlorine, bromine, and iodine, in group 7. So the fluorine has got one space for electrons that it seeks to fill. And the essence of fluorine is a hardness of the glands. And what do you know about the halogens? Is there anything that you remember from chemistry, what type of elements they are? No, the halogens are exact opposite. They're tremendously active. And if you look at iodine and the thyroid metabolism, the overactivity that you have there, these people are hyper. So the fluorine is similar because it belongs to that family, so you have high activity. Very different to your carbonic state. And they have an increased metabolism, just like in hyperthyroidism. They all tend to be slimmer, so you won't have your nice big calc type. They'll be a lot more slender and slim, and they'll have a restlessness about them. And Sankaran, an Indian homeopath, sees the fluorine picture as the nation that is being attacked by an enemy, and it builds up a strong defense with a very active element to try to ward off this enemy. This is how Sankaran sees or has the image of fluorine. So in calc fluor we'll have a lot more activity. The remedy itself actually stems from, I'll just get it up, from calcium fluoride. And in the body it's found in the bone again, in the Haversian canals. Where else would you have fluoride? In the tooth enamel, in elastic tissues, and in the epidermis. So there we can also see the affinities that the remedy has in the system. So it has its affinity again to the bones, to teeth. There's affinity to connective tissue with the elastic tissues, and to blood vessels. One thing that sort of like goes through all the calc salts is that they have an issue with the cold. So the calc fluor, even though it has a lot more activity and more heat, still doesn't like the cold very much. And in particular, they don't like the weather changes. And they don't like the beginning of motion. Do you know another remedy which has difficulties when they start to move? Yeah, Rustox. See, calc fluor can also be a useful remedy for rheumatitis and rheumatoid arthritis, where you can see the similarities there with the Rustox. So in its modalities, it is quite close there, because they're better if they continue to move, just like the Rustox, where they start to limber up, and they have warm applications. In general, they're also better for eating. Looking at what a calc fluor person might look like, they're again more on your shorter side. They'll often have small and irregularly formed teeth and have poor tooth enamel. And the ligaments will be very lax, so you can get them to overstretch their joints. And due to this, they have a great sensitivity to ligament injuries and sprains. And there you can very much use it on a pathological level for people who have had ligament damage. Also with the connective tissue, you'll have the tendency for prolapse. So looking at where you could use this, calc fluor you'll often find much more as a pathological remedy, where there's inhibited growth, people who come with repeated sprain and ligament injuries, it's a remedy for prolapses. On the blood vessels, you'll have the varicose veins, again, with a laxness of the connective tissue, the veins distending. But again, with the calcium element, you'll also get a calcification and a hardening, in particular of the arteries, so you can look at it for arteriosclerosis. Looking at the glands, you again will have enlarged and indurated glands. And lymph nodes, they'll be harder than your calc-carb lymph nodes. You'll also have an indurated thyroid gland, so there'll often be a goiter there, but it won't be a soft enlargement. It'll be more of a hard and possibly nodular enlargement, and that ties in with the fluorine element, where they do have the hyperactivity and emaciation, so you can think of it in thyrotoxicosis. On a mental level, it's a remedy that's not particularly well known, and Jan Solton has given us a bit of a mental picture there. That if you look at fluorine itself in the tooth enamel is very shiny when it's intact. So these are people who like to shine. They're your jet setters, your yuppies. They're the ones with the big shiny cars. They glitter with jewelry, and they'll have very impressive clothing. They're out there to shine and impress. They'll often have very fast lives, the people with a mobile phone rushing about. And the relationships they have will often be quite superficial relationships. They'll often be very sexually active, but on an emotionally unfulfilled level. Again, it's somewhere where you can shine and boast about the number of sexual partners you have, but not about any depth or fulfillment in this relationship. So they're preoccupied with money, but money for the sake of showing off with it. And their fear and insecurities are about poverty, because they cannot shine. On a general level, one thing that what runs through the whole remedy is the induration, and again the slowness of development, which you'll find as a component for all the calcium salts. Looking at the organ systems, you'll often find chronic suppurations from the middle ear. It's very useful in otosclerosis. Hardening of cervical glands, which also lets you think in the direction of malignancy, such things as leukemias. And then thyroid dysfunction I mentioned earlier. In the vascular system, they might often have vascular tumors. Again, you'll find varicose veins or arteriosclerosis. There's also an affinity to the respiratory tract, similar to calc-carb, but they'll have the tickly coughs and some copious discharges, often of a greenish color. In the alimentary system, you'll find a focus on the teeth. Dentition will be poor, with poor tooth enamel. On the sexual organs, in women, they'll often have fibroids. Again, you see the hardening and duration and prolapses. And in men, they'll also be prone to tumors, in particular hydrocele. And the skin is again quite an unhealthy, very dry skin. And the main essence, the nucleus of the remedy, what you will want to look for, is the issue around money. But then it's always worth asking why. People tell you that they have a fear. You want to know why they have this fear. Because there's lots of remedies that have fear of poverty for various reasons. So it's trying to find out what the bottom of it is. And for calc fluor is that they can't shine. They need that to keep up the type of life they want. You'll have the laxness of the connective tissue that goes through the whole system, the indurations, and deficiency in bones and tooth enamel. If you have this, you sort of like have the core of this calcium salt. For osteoporosis, yes.
I'm trying to find something most menopause of women.
Oh yes, yes. Yep. Very, very useful for thinking in that direction because of the bone metabolism there.
Do you have any other ones?
Of any other, well, if you look at calc phos, which we'll talk about in a moment, yes, because it has a great affinity to the bones as well. Those are the two main remedies. Hekla lava is a remedy that has a lot of issues around bones. Hekla lava, H-E-K-L-A, Hekla lava, and then the second word is lava, right? They often have an overproduction of bony tissues, but it's a remedy with great affinity there. Comfrey, symphytum, yes. It's more for broken bones, but it also has, you know, symphytum cuts down the production of callus and promotes the bone healing, so it definitely has an influence on the bone metabolism. You have to sort of like look, you know, what other things come through, but those are, you know, really big. You wouldn't. You would maybe if you come from a different background. I mean, I wouldn't give them a cocktail. You could give them a cocktail of D8s, of D6s or something like that. I mean, for some, you know, in some countries it's quite common that you get like your bone package or your liver package, and you have your taraxacum, your carduus marianus, your chelidonium, and all your liver remedies as a cocktail that you give. But I necessarily wouldn't. I'd look to see what features there are in that person as well to maybe support that.
And how often would you give them? If you're giving it for something like postmenopause bonus, would you give a very low potency?
Yes.
For every day or forever? Or?
Well, not necessarily forever, but if I was just addressing the osteoporosis and I had very little on a constitutional level that I would prescribe, but even osteoporosis, my first approach would be to look at that person's constitutional, because not every woman, less men suffer from osteoporosis, but men, I mean, we have to look at it from the age of 35, it's a downhill spiral. We lose our bone density. Women, a bit quicker during the menopause because of the hormonal changes, and then they usually catch up again with the men. But not every woman will suffer from, you know, osteoporosis, so you'll have to look, maybe there's a constitutional makeup as well, and often if you can address that, you can address that sensitivity in that person, why they might have a greater loss of bone density. But then, if nothing comes clear, if you get a lot of things sorted out and one thing might remain, that's when I would personally look to address this problem and then give it as a low potency.
What if you're trying to give it before they've got osteoporosis? Because that's why they give hormone replacement therapy, because they say it will stop osteoporosis.
Yes, I mean, there's lots of new ideas around it that don't actually verify that, but that's a discussion we can start now. If you want to start it beforehand, I mean, the main thing is that you give people advice about healthy lifestyles. You know, if you have a calcium intake of 1,000 to 1,500 milligram daily as a woman prior to going into the menopause, and you have a minimum of exercise, by minimum, I mean minimum. There's a doctor in California who did tests on 80-year-old women. I think he split them up in 3 groups. One group that had exercise, one group on calcium replacement, and one group on nothing. And the exercise group, and it was literally exercises 10 minutes, lifting your arms and lifting your legs that 80-year-olds could cope with. And they had an increase in bone density. So I think the best thing is not to necessarily address it with remedies. Even Hahnemann, if you read his Organon, the first thing he promotes is a healthy lifestyle, because no remedy is going to make up for you having a poor diet. What you often find is when you give people remedies, they have the capacity to change their lifestyles and maybe take this advice and make the effort to look at different things. That's where I think homeopathy can be useful, but it's not going to be, unfortunately, a cure-all. All right. Any other questions right now? Russell, do you just want to show the calc-carb video? But then we finish at 10:30, don't we? I haven't done the rest of the salts.
Carry on.
Yeah, I think maybe what I'll do is we'll just finish the salts and then look at the video, okay? Because otherwise there'll be a bit of an interruption. The next one that we'll look at is a rather large remedy, which is calc phos. And calc phos is prepared from a mixture of lime phosphate, and they add phosphoric acid to this, and you get the remedy calc phos. And this is the calcium salt that is probably also most used on a constitutional level. Just bring it up for you. And again, if we look at the remedy, it has an affinity to the bones. Because the bone mass, the apatite crystals, are made of calcium carbonate and of calcium phosphate. So what we have running through all the calcium salts is this affinity to the skeleton. And if we look at phosphorus, or the phosphate in this salt, well, you've done phosphorus as a remedy? Yes? Yes, there's some nods. So you know a bit about that, and that phosphorus has a lot of activity. So you'll find that this remedy doesn't have the same inertia as calcarea carbonica has, but they'll have a lot more activity, and actually one of their main features is that they like to travel. They're quite discontent. They don't have the complacency of your calc carb. They often become discontent. And because of this discontentment, this desire to move on, they like to travel. There's a very close link there to tuberculinum, and it's quite a tubercular remedy as well. The phosphate component has this response to stimuli, the reactivity. And there again you have the increased metabolism. They're hungry, they have a tendency to emaciation similar to the fluorine component. They increase metabolisms, and you'll find it in diseases like diabetes or tuberculosis, where you have this high metabolism and the rapidity with which these diseases can sometimes move on. And looking at Jan Solton, again, he sees the phosphorus component as the desire for communication. They're sympathetic, they go out there, they work to keep the relationships, not like the calc carb who sit and have people come to them. They try to get friends and gather them around them. And they have the curiosity. As I said earlier, phosphorus after calcium is the most abundant inorganic component in the body. And its particular affinities are again to the bones and lymphatic tissue. You'll find calc phos worse for weather changes, in particular in the spring when the snow melts. Again, it's a remedy with dentition. Similar to the calc carb, mental effort is quite difficult for them. They like the summer, they prefer warm and dry weather. They look quite different to your calc carb. Initially as children they might still have the slow development, but then very rapidly they have this growth spurt and start to grow, and similar to your phosphorus types, they'll be quite tall and slender. They'll have the long eyelashes and often have this soft down. I don't know if you've ever looked at children. Some of them can have this really nice fluffy furry down on the back and then this beautiful long eyelashes, very phosphoric or tubercular, with which your calc phos can come, but they don't have quite the spark of a phosphorus. There's still the calc component which give the laxness to tissue, so they might have, even though they're slim, the abdominal wall won't have the same tone and will hang a bit more. And the tissues are much weaker than in the phosphorus. On a clinical level, it's very useful for teething and for fractures, chronic swelling of the glands, remedy for repeated sore throats and bronchitis. And it's quite useful for reconvalescence following acute illnesses. I already mentioned on a mental level, they're a lot more curious than your calc carb. But they still have a lot of anxieties, because as you might remember, phosphorus is a very anxious remedy. So is calc-phos. And calc-phos, you'll find the rubric anxiety from being anxious. So they have a lot of worries, and I know that one of my patients that responded very well to calc-phos, she was worrying about worries, and if she didn't have a worry, she would find a worry to worry about. And she very much she's a very tall and slender woman who responded quite well to the remedy on this emotional picture. On a general level, what you have going through is the impaired nutrition. You'll have, in particular, also children, which is often quite unusual. They like savory things, smoked foods, bacon, sausages, and salt. Calc-phos is another remedy that likes salt, just like phosphorus is. And they can't tolerate milky products in particular, ice cream, which can cause diarrhea. Going through the various systems, they're often a remedy with a lot of adenoids. Similar again to Baryta carbonica. In Baryta carbonica, there's a lot of adenoids and tonsillitis and swollen glands. Similar to calc-carb, they can't tolerate milk, not even mother's milk. Looking at the sexual organs in women, it's a good remedy for hypermenorrhea. In skin, you've got acne and eczema. And if we look at what is the core, the center of this remedy, what we would like to see, we'd like to see that there is the curiosity, that they want to change. There's a sort of rapidity of growth. There's some sort of problems with bones and teeth, and also the anxieties. Right, have you any questions to that? Okay, we move on to the next salt, which is calc silicata. This is a very, very small remedy.
No special modalities for
Special modalities for calc-phos. Have you got it? Okay, calc silicata, just waiting till the computer brings it up, is not a very large or well-known remedy. And the silicates are a large component in the Earth's crust. Have you done silica as a remedy? No, so you don't know this yet, so I'll just show you a little bit about that. Silica is, again, quite a slender type of build. So we have not the stockiness that we find in the calc-carb, but similar to the calc-phos, more of a slim nature. And the silica persons are quite weak persons. They lack grit. If you give someone with a silica handshake, I always like to shake people's hands, even though I know it doesn't belong to the British culture to do that necessarily. But you get a good feel of what a person is like. And your silica handshake are these people who like give you the hand, but they don't grasp. You know, these don't know exactly what to do with them. They're very lax handshake, often quite sweaty as well. Not like your lycopodium who will take your hand and shake it thoroughly. And they have the laxness of the tissues and the problems, again, with bones and dentition. And the affinity in this calcium salt is with the respiratory tract and, again, the skin, and also with the nails and teeth, because we have small quantities of silica actually in our teeth. They don't like the cold and physical exertion. And again, what we find there is chronic catarrhs. On an emotional level, Sankaran has wrote about this remedy that it has a strong need for security, and there is a province in India called Kerala where he very much sees a calc silica strain going through. This is an area in India where there's a strong tendency for communism. And if you look at communism, what it actually does, it fulfills a certain sense of security. It has quite a structure, giving everyone their place in the community. And they're very sensitive people with a mild personality where the silica component comes in. Silicas are very, very sensitive people, very exact people, also fastidious, not with the same drive as your Naxvamika, but their motive and their aim is that if they're not that meticulous, if they don't work that hard, they're going to fail. There's this really strong sense of failure in silica, and for that reason it's often a very useful remedy to think of, just like gelsemium, in people who have examination fears. And you have this mildness and the sense of yielding going through calc silica as well. The pressure, it might be useful for someone where the pressure of the parents is there, that they need to perform, but they're not quite up to it. And often their way of withdrawing is by becoming ill, because if they're ill, no one can make any demands on them to perform. It's like the son who should go into the father's business but can't quite cope with that because he doesn't want to perform in that way. It's a chili remedy again. That's one of the main general features. On local level for the skin, it's very useful for acne, rosacea, and for abscesses. Silica itself is a wonderful remedy for boils and abscesses and chronic suppuration. Okay, now the last salt that we'll talk about today is calc sulf, a bit of a larger remedy. You've done sulfur as a remedy? Yes? Oh no, I asked you that before, didn't I? You haven't. I'll just bring it up on the computer. In sulfur, the component is that there are often remedies that have a lot of initiative, or people with a lot of initiative, a lot of ideas, and they go out there to fight and to struggle. And the theme of a sulfur is that they make a great effort to succeed. They're a bit more of a scruffy remedy, or known to be, or they can be quite scruffy, a ragged philosopher. And a lot of their discharges can be quite offensive. And they also have an issue around clothes. Either you'll find people who come with their shirt tails sticking out and maybe a hole in their jumper and their shoes rather scruffy, but you can also have the alternative that they're people that are very concerned and conscious about the way they dress. So there's an issue for sulfur around clothes, either very nicely dressed or they really don't care. Sulfur has a fear of poverty as well, an anxiety about their business, and they're very industrious. So there it's more of on the business side, and not necessarily like we have with the calc floor that they want to shine. They easily feel criticized, and they have a very strong need of approval. So you'll find this in the remedy calc sulf as well, that they have this great desire of approval. And that's often why they dress in that way, because they want to feel approved for the clothes that they wear. The remedy itself, as you might know, is plaster of Paris. So there again we have, if you look at plaster of Paris, it gives some form of structure and solidity that you use as a cast then to help someone's bones or ligaments heal. A remedy again with an affinity to connective tissue and the skin. It's worse for drafts and for the warmth, because here we have the sulfur component coming in. Sulfur is a very warm remedy. Who can't tolerate the heat. and this is more of a warm calc salt. And they prefer to have open air. They like to be uncovered. The sulfur component comes in here, sulfur will kick and throw the covers off. And it's a very, very useful remedy for acne, as you can imagine, with the suppuration that you see in sulfur. You often find wounds that are very slow to heal after a tooth extraction, where there's always a bit of pus for weeks and months coming out of where the tooth has been extracted. Fistulas, and you have the infected eczema. On a mental level, as I mentioned earlier, their main theme is their strong need for appreciation, for which they'll work very hard. They have a component of jealousy, and also specific, they fear birds, similar to Ignatia, that's also frightened of birds. They're more warm-blooded, and you have suppuration going through all levels, from the skin, again from the ear, tooth extractions, any discharges, vaginal discharges or urethral discharges. And they like sour things or green fruit, similar to Mediterranean, who likes unripe fruit. We have discharges from the ear again and from the nose. Respiratory tract, similar, purulent phlegm and empyema. On a digestive level, we've got purulent diarrhea, anal abscesses, for which is very useful. Then heparsol. Yes? No? Very useful remedy as well for boils and abscesses. Skin, we have this going through again, the acne, boils. Hidradenitis, which can be, as you might know, a very difficult condition to treat conventionally. And if we look at the core of what this remedy is about, there's the constant suppuration on all levels. You'll find that it's a warm-blooded calcium salt. And on the emotional level, what you're looking for is the strong sense and need to be appreciated. Okay, this is just a quick introduction to calcium and its salts.